think this is a great time to start, actually. So,
Yeah, go for it.
hi everyone, welcome to today's Nutrition and Medical Sciences BSc tester session. Thank you so much for joining us. My name is Eleni Diogenos, and I'm currently a BSc Nutrition and Medical Sciences student here at UCL and your chair this afternoon. We're hoping that this taster session will address those course-specific questions that you may have and will help you gain an insight into what it is really like to study on our Nutrition and Medical Sciences undergraduate program. So, this afternoon, our speaker, Dr. Adrian Slee, will introduce you to some of the great science and medicine that you will learn as a student of Nutrition and Medical Sciences here at UCL. Dr. Slee will also provide a summary of the Nutrition and Medical Sciences program, and there will be a Q&A session for the second part of the event. This session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom, which you can find on the toolbar at the bottom of your screen. Now, to introduce our speaker, Dr. Adrian Slee is a registered nutritionist and the course director for the BSc in Nutrition and Medical Sciences at UCL. Dr. Slee teaches and coordinates several modules on both undergraduate and MSc programs and teaches topics including nutrition throughout the life cycle and body composition, which is anthropometry. Dr. Slee also conducts research examining the importance of malnutrition in aging and how this relates to frailty. Over to you, Adrian. Thank you.
Thank you so much, Eleni. Much appreciated. So good afternoon, everyone. I hope you're all doing well. And I'm sure you come from all different parts of the world, so it's really nice to have you here. So a little bit of background. I'll just tell you about myself quickly. So my original background was I did a degree in physiology, biochemistry, and nutrition, because I was interested in lots of different things. When I was a lot younger, I was interested in metabolism and exercise. So I was really interested in exercise when I was growing up. I thought, I really want to know what happens to the body. So all these like metabolic things that people talk about and hormones and stuff, I wanted to understand how these sort of work and interact. But as I did my degree, I started to become very fascinated with certain things. So for example, I was interested in muscle, so skeletal muscle. And so, for example, muscle is really important for exercise performance, but also it's really important when you have certain disease conditions. And so what's happened is my research, so throughout the years, did a PhD and all the rest of it, and so I've become very interested in what happens in certain chronic diseases, such as cancer and chronic kidney disease, and how that affects, for example, you get basically muscle wasting associated with that, and how that affects patients' quality of life, for example, morbidity and mortality, and how you might be able to impact and change things for the better to try and improve patients' lives, essentially. So by doing one thing when I was, in my teenage years, I was interested in exercise and metabolism. I've gone the whole way through the cycle, as it were. Did a PhD, and that was a molecular PhD. So I was looking at gene expression of different proteolytic systems that control protein breakdown in muscle, and how they're affected by different things like nutrition, for example, certain drugs. And again, the idea was that you could potentially look at those and manipulate them in certain disease conditions to try to help patients. Because in the end, that's been my interest, actually, is how to improve patient lives. In amongst that, that's the research side of things. I'm actually, my main role is I'm a teacher, and I love teaching. This is what I do. And I'm the course leader of the BSc Nutrition and Medical Science degree, which has been running for several years now, but also for the 4 MSc programs, which are very popular. We have 120 students this year on our 4 programs. I'm going to talk about them at the end. So we're very busy and having fun as well, because we really enjoy teaching the course I'm going to talk to you about now, essentially. So today I'm going to talk to you about some interesting areas of not only research, but what it's like to be practically, if you become a nutritionist, so at the end of this degree, you essentially become what we call an associate registered nutritionist with the Association for Nutrition. That's a government body in the UK. And so it's an accredited course. But to be a nutritionist, you need to know some certain basic things. So, for example, we want to be able to understand things like what energy balance is and to be able to perform a nutrition assessment. Because actually, this is essential. This is the bread and butter of what a nutritionist might do, or a dietitian, for example. So I'm going to talk to you about that, talk to you about a bit of science behind it, because I'm assuming most of you have done biology, so you should have a pretty good understanding of basic stuff in metabolism, so which I think might help. I'm going to try and put a few different things together, a few key concepts. And then to finish off, we'll talk about the actual degree, and then we'll take some Q&A, some questions from you guys, and anything at all on any of the aspects we cover today. So what do you mean by the term energy balance? So it's just I might even put my Q and see if I can get the Q&A up as well in the background. So if anyone's got any, can't actually get that up. Usually I like to ask questions. It's nice to have people come back. So if anything comes out, right? So Lenny, if you could ask you very kindly to look at the Q&A for us. So it's nice to have people getting involved, right? So feel free to answer. So what do we mean by the term energy balance? Has anyone got any idea at all?
We did have a question asking if medical sciences means dietetics.
Okay. Tell you what, all the course-related questions we'll cover at the end. That's what we'll do. All right. But it is a good question, and we will cover that. But what do you mean by the term energy balance? Anyone got any ideas? Well, thanks, Eleni. Cheers. And let me see if anything comes in the Q&A. Tell me. Otherwise, I'll keep going. So you might have heard this term before. Okay. In nutrition, we're very interested in energy balance because many of the issues that we have in our society, okay, public health, nutrition concerns, relate to energy balance, actually. And so one key issue that we have, for example, has been the quite dramatic rise over the past 50 years or so in the prevalence of obesity and type 2 diabetes. And so what happens is when we talk about the term obesity, it essentially means you basically laying down an inappropriate accumulation of fat mass. For that to happen, you need to be in a positive energy balance, which means that you're basically consuming more calories than you're expending. So the energy balance is tipped the other way. So you're consuming, so as an example, you might be consuming in your diet 2,750 or 3,000 calories a day from, it could be from whatever foods or drinks, or it might be some, it could be from alcohol and sugar and et cetera, right? But the actual calories that you expend, the calories that you burn, so some of them are going to be at rest while you're sleeping or during the day with physical activity or actual exercise sessions as well. So the total of that, if it's say only 2,000, there's a net increase there where you're gaining energy. And the idea is we store this energy in different ways. You can store some of it as protein, but tend to find that a lot of it gets stored, for example, as fat, which is a very efficient fuel source, actually. So this is one of the issues, one of the issues that we have in our society that relates to energy balance. The other issue is the opposite end, and this is the stuff that I'm personally interested in and my research relates to, is disease-related malnutrition and wasting. Now, in certain countries, and it's starting to become more common in places like the UK, with the advent of things like food banks and all the rest of it, with the financial crisis, just normal starvation malnutrition has become more common, actually. But we also have this term of disease-related malnutrition, because once someone becomes ill, if you have a chronic condition, like cancer and kidney disease, and there are others like heart failure or COPD, for example, it has a very detrimental effect on our metabolism. And lots of weird things can happen. For example, that what might happen is that you have a loss of appetite. That's very common. Lots of things that you produce, lots of inflammatory molecules that you produce during disease, they go to the brain where you regulate appetite in the hypothalamus, and it switches off your appetite. So you don't feel like consuming any food. And some of you yourself, if you've been ill before, then you probably know you don't want to consume any food. So your energy intake goes down. Now, that's fine short term. It's a response, it's your body's way of trying to deal with things. If it's chronic, though, as a chronic condition, that's not good. And at the same time, the calories you're expending, that can vary depending on different conditions and if you're physically active or not. But if there is a negative balance now, where you're losing more calories than you're essentially spending more than you're consuming, there's only one thing that happens, and you lose tissue. So stored energy, which obviously some that's going to be fat tissue, but what we find in disease conditions, you actually lose a lot of lean tissue, which I'm going to talk about later. For example, skeletal muscle is made of protein. The problem is with that is that loss of tissue, the amount of loss and the rate of loss has been shown to increase risk of things like just general morbidity and mortality, and also disability, for example. So these are really important areas in nutrition that we cover. We cover this in our modules on the course. So how can we assess these things? So I've said to you that these things are really important, right? So it's like a take-home message for the day. But imagine if you become a nutritionist, you think, well, how do we assess this, right? Because there's different techniques, there's different methods. Some are better than others. Some are more practical than others. Some of them might be more accurate, but they're more expensive and not practical. And so again, these are things that we cover in the course. We talk about, we cover, we analyze all the pros and cons of different assessment techniques. So in terms of dietary intake, there are ways of estimating, doing things like diet diaries and things, where we can estimate your dietary intake. So for example, how much energy, but then also the macronutrients, so carbohydrates, proteins, fats, how much you're consuming. We can actually assess your energy expenditure, so how many calories that you're burning per day, which could be, again, at rest or with exercise, or both, and have a look at total global energy expenditure. We can also look at your body size and your reserves, your energy reserves. So when we talk about your energy reserves, that could be, for example, the amount of fat tissue you have, the amount of muscle tissue you have. And again, there's different techniques that are more practical than others. And we cover this. And Mariam has her hand raised. Now, I'm not sure, I think I'd love to answer your question because I much prefer it to be interactive. I much prefer this. I find it's much more enjoyable for me, but I think the microphone function is disabled. But if you want to put it in the chat, if you've got a question, Mariam, please feel free to put it in the chat. I'll see if I can access the chat at all. Let's have a look. So Q in the chat. So Mariam, did you want to put your message in the chat? And let me have a look to see anything. Well, anyway, if whatever questions you got, please just put it in the chat. Q&A will come to that. So for dietary analysis, now, this is just for a bit of fun, because usually when I do these talks, it's usually around Halloween. A couple of weeks later, we're just joking about this before coming on the call. We should be in Turkey now because we're starting to get ready for Christmas. So there's different things you can do. There's different techniques, but essentially we can try to use different things like diet recalls and diet diaries to see how much you consume over a period of time. Now, if we've got an accurate record of the type and the amount of food and portion size, then we can put that into a specific software. And I've just got an example here. This is pumpkin as an example. And then you can put, for example, just say, for example, 1 cup of mashed pumpkin, then you get information on the amount of calories, for example, the energy, on carbohydrates. So we can have the grams of these macronutrients and the calories that they compose of. And also you've got some breakdown of different types of things like fatty acids and also micronutrients like vitamins and minerals. So that's actually really useful. So, and that also tells us as well, this is for a separate lecture, obviously, whether someone has a complete diet, because you might have the energy requirement, but what if your diet is actually really poor in quality and is devoid of all these really good things, like all your vitamins and minerals that are critical to keep you alive, to make things work. So, for example, all your enzyme systems, they need cofactors, for example. And so, yeah, so we can look at all these different things. Now, you might already be aware of this because it's pretty common knowledge, okay? So you might be aware, for example, of how many calories there are, kilocalories per gram of carbohydrate and protein, which is about the same. It's not exactly full, but it's about the same. Fat is very energy dense, so you have 9 kilocalories per gram or 37 kilojoules per gram, and alcohol is 7 kilocalories per gram. So when people say actually, drinking alcohol can be fattening, well, it can in lots of different ways because of how it affects your metabolism, but also because the energy as well, the extra energy you put into the diet. For energy expenditure, you have to think about what's happening. I've got my guy up here doing a bit of activity. So every day over a 24-hour period, you might be sleeping for 8 hours. So although you've got low physical activity, at rest, your body's still working. So to keep your heart functioning, all those essential activities, and actually those key organs, like for example, like your liver and brain, you're using quite a lot of energy actually. And you'll make it, and hopefully you guys have done maybe A-level biology, done metabolism yet. So you might have seen this before, some mitochondria. So when you do oxidative metabolism, if you've got oxygen present and you're breaking down fuels to make ATP, probably heard of that before as well. So there is a way where we can work back on the cells to estimate how much food you're metabolizing and burning, essentially how many calories that you're burning. So when we think about it, they say, well, what's actually happening in the body? Okay. So when we have this oxidative metabolism I talked about, so say during rest and exercise, you're going to ask, well, what happens during metabolism? So we use oxygen, so which you're probably aware of. If you haven't got oxygen, your mitochondrial oxidative metabolism isn't going to work. You may have seen this before. I'm not sure. Some of you might, some of you not. So in the mitochondria, which is the powerhouse of the cell that breaks down all these different things, so you make ATP, which means you can do work. The ATP is your energy currency for the cell. Okay. So when you break down food, you break down glucose, for example, here, and you break it into all its constituents. And in the end, what happens is these things here that are produced, they drive this process to make ATP. But for that to happen, you need oxygen. That's oxygen there. It's what we call, it's called a terminal electron acceptor. You have a hydrogen proton pump. Now, even if I lose you with the mechanism of what's going on, you just need to know that oxygen is required and you make water. So this bit's important because we can measure that. So even at a cellular level, you're using oxygen at a cellular level. Obviously, you take the oxygen from outside, from the environment, goes through your lungs. Okay, so for your breath, so we can measure that. At the same time, one of the waste products, again, this is basic respiration. You produce carbon dioxide. So you make carbon dioxide. So, for example, here, you've probably seen this before. This is the TCA Krebs cycle. So when you break down glucose, first of all, you produce a bit of CO2 here. And then in the Krebs cycle, you make some CO2 here, some CO2 here. When you break down fats, it goes a sideways pathway. So you actually miss this step. That bit's important. The difference between these is it means it changes the ratio of things. So what that means is it means that if you've got 1 mole of glucose, and you've probably seen this in your A-level biology, you use 6 moles of oxygen, and you produce 6 moles of CO2. So it's a 1-to-1 ratio. Right? That makes sense. We call this the respiratory quotient, CO2 to O2 ratio, and that's 1. Or the respiratory quotient. Some people call it respiratory exchange ratio as well. They're pretty much the same sort of thing. So that's interesting because it means that we can quantify how much is happening. We can also work out if someone's burning more carbohydrate or burning more fat, actually, which is interesting. So, for example, here with fat, because I just said that if we're going sideways here, we're breaking down more fat, we're producing, say, for example, here you've got your 2 moles of CO2, so you're missing one here. The ratio is different. So, for example, you're breaking down, this is palmitic acid, certain type of fatty acid. Now you've got less CO2. So the ratio 16 divided by 23 O2 is nearly about 0.7. So that's interesting because it means that you can work out if someone's burning more fat at rest or during exercise and what type of metabolism they have, which can change with many different situations. So if you look at it, so you have starch, you've got glucose, you've got fat, protein, and alcohol. You can quantify it. This is interesting. It means, for example, I mentioned fat here because it's really energy dense. So it's around 39 kilojoules per gram. Again, it depends on which conversions you use and depends on the fatty acid, but in general, it's about 9 kilocalories per gram. Okay. If you then look at the amount of liters per gram of fat of oxygen consumed and CO2 produced, you can see this is 1.9 versus 1.4 here. This is very different. So it means we've got a very energy dense molecule. We're using more oxygen per unit. Okay. So it means that we can actually measure this. And this is actually what we do. We do this in our practicals in class. We do this, it's called a Douglas bag technique. Very simple, actually. You just basically breathe into the bag through a set of valves. We measure the air. You can see my pointer, the air in this bag. We do it at rest and during exercise. Because what you should expect if you go from a resting level and suddenly you increase your metabolic activity, you suddenly have muscle contraction. And I'm sure you've done this in your A-levels. And when you have actin and myosin in the muscle. So when they contract, you have a sliding filament theory, you use ATP, right? ATP is necessary. Obviously, you need other things as well, like calcium ions and things, but ATP is necessary for muscle contraction to occur. So if suddenly you go from rest to exercise, to heavy exercise, you should see, we can measure this in the back, that you're probably going to produce more. So you're breathing out more, okay, air. So your volume will increase because your metabolic activity is increased. And we can measure the O2 that you've consumed, you've inspired, and the CO2 that's expired. From this, we can then work out actually how much energy you are burning, so your energy expenditure in kilocalories per minute. There are different ways of doing it. We can assess it over a whole day as well by taking snapshots or using other techniques. The other thing to say is that, again, because this is the nature of our course, so we're interested in what happens normally with exercise, but also in disease as well, as a nutrition and medical science degree. And as I say, lots of our students do go on to do dietetics. We were interested in what happens in the hospital. So for specific patients, for example, because what can happen is, if a patient is really unwell, you get a very high inflammatory response in the body. And examples in the intensive care unit, some really good examples with trauma, burns patients, sepsis, for example. You get a very strong, what we call like a stress response in the body and an inflammatory response, and that drives metabolism. So it means your body works harder at rest. So this guy here could be completely resting, no physical activity at all, but he could have the same metabolism, metabolic rate as the person exercising. So we can measure that, and we teach you how to do these things. And it's again, it's very fascinating. Why is it important? Well, there's lots of reasons why it's important. In exercise for athletes, it can be really critical actually, because it could be absolutely critical if you're trying to optimize performance. Okay. There's also a lot of new research stuff that actually that we've been involved with at UCL. Some of my previous students at both the BSc and MSc level have studied this. There's something called relative energy deficiency in sport. So sometimes you have athletes, particularly those who are very competitive, who are trying to compete, it could be like whatever it is, like world championships or whatever, or even Olympics or something. And because they put themselves under so much stress, so you have physical stress, but also psychological stress. And if you're not consuming very much food, because that tends to happen as well, start to lose weight and your energy expenditure is higher than energy intake. And it means that can affect not only your performance, it can mean you have a detrimental impact on performance, but it can also have an impact on your health. Because imagine all your essential systems, body systems, start to say, well, you know what, we start to reprioritize our requirements. And so there's certain things that actually start to shut down. And there have been examples of some extreme athletes, for example, like ultra endurance marathon runners, for example, where they get some real disturbances in function, like reproductive function in particular, for example, because of the effects of extreme exercise, essentially. So that's why it's important to measure these things from an exercise perspective. It's important from a public health perspective as well. So, for example, again, going back to the beginning, talking about things like obesity, for example, being able to understand, energy expenditure for different population groups is important, because you might say, well, that means then for this specific group, we need to suggest or recommend so many kilocalories. In critical care settings, so for example, going back to things like this, so in the intensive care unit, or actually, for example, in patients who do have life-threatening wasting conditions, then actually this is super critical, because if you under or overfeed patients, that has been shown to be linked with mortality risk. And so actually trying to get that right is actually really important. And in the critical care setting, like in the intensive care, ICU, then it's now been suggested that that is like a gold standard technique. We should be doing this routinely. So it's important, but however, that's the whole point of this course, is to try and teach you the basics behind this, the theory, and then you actually do a bit of practice yourself. And if you go on to do dietetics, then, for example, you might end up working in intensive care unit. And we actually have, and for example, we have an applied nutrition, clinical nutrition module that Eleni was in this morning. In a couple of weeks' time, we actually have someone from the intensive care unit, a dietitian, talking about some of these aspects, as an example. So we can measure these, we can measure intake, we can measure expenditures. This is part of the story, right? But the other part of the story is, well, actually, we also need to work at what's happening to the body. What is the body made up of? For example, it's quite simplistic if we just look at the body mass index that you've all heard of before. And I think in our society, we've become kind of obsessed with the body mass index. It's become synonymous with the idea of either this concept of, everyone talks about, again, obesity and rest of it, or going the other way. When we talk about with eating disorders, very low BMIs. And so I would say, and I think some of my colleagues agree, that we've definitely become very obsessed with this concept. And all the concept is just your body weight divided by your height squared. It doesn't tell you anything about the composition of your body. So how much is made up of fat? How much is made up of protein, like skeletal muscle or your organs, for example? Because it can be very different. So we've got an example here. So I've put here body weight and BMI. It's only part of the story. As I always present this, because it's always just for a bit of fun, really, just to highlight this point. So you've got these 5 guys here. They've all got the same body weight, 70 kilos. Different height though. So this guy, he's really tall. Okay, we've got someone with a shorter stature. Then you've got someone who's muscular, someone who's inactive. This is the waist circumference, WC. So you can see here that the shorter and inactive people, they've got a higher waist circumference. SM is skeletal muscle. And so what you find is that actually, this is the body mass index. This is absolutely healthy, normal, apparently. This is a little bit on the low side. This is technically classified as being obese. And these two guys, they're absolutely perfectly normal, absolutely healthy. Okay. So this is an example, again, where if you become obsessed with body weight, it doesn't tell you anything. Because if you look here, there's a completely different waist circumference. So this person has, nearly 20 centimeters greater waist circumference. And what happens and again, you may have heard of this, there's been quite a lot of information on the media about this. If you start to store more fat around the waist, we have this concept of visceral fat. So it's basically a fat tissue that's around your organs. And so we know that's been more associated with things like metabolic diseases, like type 2 diabetes, for example, and risk of cardiovascular disease. So it's a very different thing. These people have got very different body compositions. And this person here has got 6 kilograms less protein as muscle. So you have a very different risk profile, actually. So for things like cardiometabolic, cardiovascular disease, very different, even though this person is meant to be completely healthy and normal. And literally just what I just mentioned. So we can measure these things, so body composition. So when we think of body weight, as I've just mentioned, what's the body made up of? So you can look at it in different ways. You can look at something called fat-free mass. Fat mass, that's like the two compartment technique for looking at body composition. And so the idea is you've got fat mass here, everything that isn't fat, which is muscle, organs like your liver, your brain, your heart, your GI tract, for example, water. And remember, you store water inside the cells and outside the cells, okay? And in your bone tissue. And there's this other concept of lean body mass or lean soft tissue, which doesn't include the bone tissue. But most techniques tend to use the two compartment model body composition. But there are other techniques, there's more advanced techniques where you can break this down and look in more depth and with greater accuracy. So what do we do in class? Okay, so these are things that you basically would do. Elaine did this last year in our growth and development module. And again, these are like super essential skills. If you want to be a nutritionist, you need to know the basics. And the basics are, for example, this is a really practical technique because it means all you need is a tape measure and you need a pair of skin fold calipers. Now, these are actually meant to be the gold standard. These are like really high quality ones. These are the Harpender ones. However, they're portable, it's practical, it's cheap, relatively cheap, I should say, like only a couple of £100. And there is an issue that obviously in terms of accuracy, yes, there's variability, you have to be highly trained. However, it gives an indication. So dietitians in hospital to have a quick idea, quick estimation if someone has muscle wasting, for example, or visceral obesity, you could measure waist circumference. You can measure calf circumference to measure muscle mass. We can take the skin fold thickness, this is on the back, the tricep, for example, and we can take the circumference of the arm, the mid-upper arm, and that gives us, using an equation, we can estimate how much muscle we have. It's an estimation, it's not wholly accurate, but it's something that dietitians would routinely do in clinical practice. So we teach you how to do that.
I really enjoyed doing that practical last year, and we did get pretty accurate results, I think. So
Good. Yeah, no, and it is fun, isn't it? It's a fun practical to do. In fact, if remind me on that as well, because we have another module, nutritional cancer treatment module, where you get in the third year, we get another chance to do this type of work. Eleni, I need to invite you to that as well, actually.
I'm not in that.
So yeah, so just the students, but you get different times where you can get to practice this stuff. And also, if you do a research project, some research projects where you might really enjoy this type of work. And I have students now that be recruiting participants, could be like people from sports teams or members of the public. And actually in this room, you can't see the background, but this is actually our testing room, where we test people and do this type. But it's really practical, it's super useful. It means that, in a few minutes you have an estimation if someone's got low or high fat mass or muscle mass, etc. This is bioelectrical impedance. So really simple technique again. It's a complex technique in terms of what it is, a lot of complex physics behind it, but it's simple in terms of the fact that you could use a portable device, small device, doesn't weigh much. It just puts a small current through the body. We use different devices here. And the idea is you measure impedance. If any of you done physics before, maybe at a GCSE, you might remember the concept. When you put electrical current through the body, you've got an impedance to current flow. And so this depends on the amount of fluid you have. So if you've got fluid inside the cell and outside the cell, remember fluid has electrolytes. That means electricity current can flow. But if you have, for example, bone tissue and fat tissue is like an insulator. So by using certain different types of equations that have already been set up and been developed and validated, we can estimate your fat mass, your skeletal muscle, the amount of body water you have. And again, we do this in class, and we do this actually in research. This is part of the research. So I've taken actually a device very similar, even into care homes, actually in hospitals. So my work is, for example, in frail older people. So I've actually taken a device very similar to this, by literally going to a care home to by someone's bed, someone's just lying down, they might be disabled, because this is the benefit of this device, it's very portable. So if someone has a condition like a disability, mobility issue, you can just assess them really simply. Just put 2 electrodes on the hand and wrist, 2 on the foot. Takes a few seconds to send the current through the body, and you get some useful information. If you want more advanced techniques, then this is what we unfortunately don't do this practically, because it's actually quite difficult and quite expensive. Actually, you need very specialized equipment. So, for example, you could do a DEXA scan, or you could do a CT, computed tomography, or MRI scan, for example. Typically, these sorts of techniques are only done routinely in the NHS for very specific conditions. So, for example, usually a DEXA scan is done, for example, if you wanted to measure your bone mineral densities for osteoporosis risk. So you can see in this image here, you can see all in blue, this is the bone tissue. So that can give an indication, for example, if you've got a healthy amount of bone mineral, and again, if you're at risk of osteoporosis. But there are other ways of doing this imaging. And if you look closely, for example, in red, this is your lean tissue. So like your muscle, organs here, and then your muscle. And then on the outside, you can see the yellow tissue, that's the fat tissue. So actually, it's a really good technique. It's actually a reference standard technique. It's more commonly used for this type of work, for body composition assessment in privately, actually, or in research. I've actually had this done myself, just for pure fun and entertainment, because that's what I'm interested in. It cost me about £170 in Harley Street or something. But it is actually really interesting. And again, I compared it to my bioelectrical impedance results. They're actually really similar, which was reassuring. But we talk about this, we talk about the theory behind this and why it's really useful. Because these techniques are suggested to be reference techniques for diagnosis of things like specifically like disease-related malnutrition, cachexia, and sarcopenia, muscle wasting type conditions. So that is, in a short period of time, a super quick overview of some science. So the idea is that you learn these key skills, key things that when you come out of this, you become a nutritionist, and you can try and you measure these things, or you know what to do, you know what to look for, right? So can I quickly ask, Eleni, are there any questions at all in the chat? So just before I talk about
Yes, there is a question about if there is a scholarship for international students.
Okay, so tell you what to do. Anything like that we'll do at the end. Is there anything specifically around this science stuff? Has anyone got any questions on what we've covered so far?
Oh, we just got a new question.
Oh, great.
Are dietitians usually exposed to this equipment, DEX and MRI, in their work?
That's a really good question, actually. And so, like being honest, routinely in the NHS, these techniques, for example, here, they're only usually used routinely for things like, for example, checking for your bone mineral density. This, for example, things like CT scanning, for example, usually routinely, it could be, for example, if you're assessing, it could be for liver disease, or it could be for cancer to look for metastasis rather than body composition. More routinely, which is good to hear, people start to use things like biological impedance because it's a cheaper technique and it can be used practically and it's portable, which is good to see. And then again, much more frequently, people do things like basic anthropometry, which is really good. Along with some other, there's other things you could do that I haven't mentioned here. Things like functional tests. You can measure things like grip strength, for example, using a grip strength gauge. These things are typically done routinely. Any other questions at all about science?
Not regarding the equipment, but someone asked if we can influence which energy substrate the patient is using by changing the respiratory rate.
That's really interesting. So that is like probably a question for another time because otherwise it gets quite complicated. I'll give an example of how you can manipulate this and how the body works. If, for example, you've got good fitness, and what I mean by that is if you exercise regularly, so say you become an endurance athlete, you will, I'll just give you an example. What will happen is you will regulate. So the slides go very, very slowly, unfortunately. You will upregulate all your mitochondria. So, for example, here and here, if you suddenly become like a marathon runner, you will upregulate all your mitochondria. So you have more mitochondria in your muscle. So your ability to produce ATP is enhanced. So it means the ability to do certain, if you've got higher energy demands, for example, you start to become a marathon runner, you start to run at a faster pace for a longer period of time, your body has to adapt to that. Because you might have like greater muscle contraction ATP requirements, for example. So you upregulate the amount of mitochondria you have. That also is going to have an influence as well of how you metabolize fats and carbohydrate, actually, which is interesting. And so one interesting thing, we teach this on the sports nutrition module. One thing that happens is you actually become what we call glycogen sparing. You start to utilize more fat as fuel to spare glycogen, which is your storage form of glucose, because it's so important. So there's lots of things here that happen. There's also some weird things that happen in disease. And then obviously if you come to the course, we'll talk to you more about that. But what I will do is, because of time, because I make it 5:15, so I tend to get carried away and then 45 minutes are gone, so I apologise for that. So if I keep going, we'll go to some talks. Here we go. Right. So I'll do a few slides on the course, and then I'm happy to take any other questions whatsoever. So as I say, so we've got this nutrition medical science degree. So we've been running for several years now. We're very happy with it because obviously we're happy because it's very successful and I personally love doing this because it's my passion, but also because it's actually a novel course in that, as far as I'm aware, there is no other course in the UK that has such a diverse range of modules, actually. And so we cover lots of fascinating things, such as, for example, I've just literally just mentioned, you got your metabolism. So we have nutrition and metabolism modules. We talk about obesity and malnutrition from all different angles. We have a clinical nutrition modules. We're definitely within mind because it's a nutrition and medical sciences degree, and because many of our students do go on to dietetics. We've got this strong clinical focus, actually, which is very important. We also have sports nutrition. We have novel modules of frailty and aging. This is something that I run these, obviously, because this is my interest and passion, research. But if you're interested in other things like behavioural nutrition and public health nutrition, because a lot of our students tend to go in that direction as well, either dietetics or public health nutrition. So you have some very specific modules on that, as well as some fascinating optional modules, which again, I don't think there's certain modules I don't think are even, you know, a BSc level. I don't think there's any other course in the UK that have offered these. So we have modules on nutrition and cancer, and I want to talk about in a couple of slides' time, on the microbiome, for example, which has obviously become far more relevant and out there in the media, actually, because we realise what an important role it has on the body. So we cover a lot of different things. I'll talk about this last bit as well in a minute. That we're also not only a very specialised course, but we're creatively associated with nutrition, which is actually really important. I'll talk about in a few slides' time. So the way it works, in our year one, a lot of our modules are linked with what we call the integrated medical sciences suite of programs. So in the first year, you'll do lots of physiology and pathophysiology modules that are very much focused on different organ systems, like the cardiovascular, cardiorespiratory systems, and it could be the gut and the liver, for example, the kidney. And you get those modules are taught alongside the other programs. Like, for example, we have applied medical sciences, we have cancer biomedicine, for example, sports and exercise medical sciences. So you're taught alongside, and then you do nutrition, then you become more specialised. So just to give you an example of some of the second year modules. So we cover lots of metabolism. We have this growth and development module. We talk about everything that happens throughout the life cycle, which is obviously absolutely crucial. So we talk about what happens from pre-pregnancy, pregnancy to through whole of the growth periods, adolescence, all the way to old age. And then we have, as this module goes across both terms, malnourishment and obesity, we cover from both ends of the spectrum. People who have disease-related malnutrition or eating disorders, starvation-induced malnutrition, all the way to obesity. We also cover, this is a really important point here, these two modules here, we try to set you up and prepare you for research and your dissertation, which you do in the third year. So we try to cover these modules in the second year to get you thinking about what research is in the first place, and how to actually perform research and different statistical methods that you might need, for example, because that's important in understanding research. And then we have some other content, for example, molecular-based disease module, which is linked with the applied medical sciences course. And then we have a few interesting novel modules, such as nutrition and cancer risk. So where we look at for example, the epidemiological evidence around, it could be certain foods, and alcohol, for example, red meat and vegetables, and their relationship with cancer risk from a population perspective. In the third year, this is where we become super specialised, and we cover lots of, again, really interesting stuff. So this is the applied nutrition, clinical nutrition module. This is the module that Eleni did this morning. And we cover pretty much most things, most key aspects in the clinical nutrition and dietetics world. So all the key specialties. So we have dietitians coming in from, I think it was pediatric nutrition this morning. We've got people coming from liver disease, renal disease, ICU, intensive care, for example, cancer nutrition, the whole range of specialties. And again, so this is essential if you want to do dietetics, really. If you're interested in public health nutrition, we have this in term 2, and that goes alongside this behavioural nutrition module. So these again are super important if you want to go towards more of a public health nutrition career or an MSc, for example. Obviously, we cover sport, and this is one of my favourite interests and modules. I'm a module leader for this one, and we talk about what happens in different types of exercise, and again some clinical issues as well. So things like eating disorders in sport and that relative energy deficiency in sport. So again, we're still with a bit of a clinical focus. And then the frailty and aging module that I mentioned earlier. So again, we cover all sorts of things that happen as part of normal aging, but also in disease. And we talk about this concept called frailty. And we have lots of clinicians, experts who can come and talk about things like care home nutrition, hospital-based frailty assessment, lots of different things. Then again, we're just pretty super lucky, really, that we have lots of different experts from different areas around the division and other division who put on different optional modules. So, for example, if you're interested in things like it could be just in the industry, it could be, for example, have lots of students go off work in drug companies, for example, who work for clinical nutrition companies or other different types of companies who specialize in science. It doesn't have to be nutrition. They tend to do the biomedical entrepreneur module. If you're interested in microbiome, we have a module on that. And then we have this very specialized module. I'm actually co-lead of that module with the division of cancer. This is looking at what happens once someone actually has cancer and going through treatment. So, for example, things like radiotherapy, surgery, chemotherapy, and how the cancer itself and the treatment affects nutritional status. And again, so this is very research focused, where we have lots of clinicians from the hospital come and teach in the module. But then we have our dissertation. That spans across 2 terms. We've changed it a bit this year that students start a little bit earlier, which is good, which is definitely very beneficial. And we have a whole range of different projects actually relevant to nutrition. You can do everything from, we have questionnaire-based public health nutrition projects. We have people going to food banks. Some of my projects, I've got students who are doing not only online questionnaires, but actually recruiting participants, athletes, bringing them in, testing them with body composition assessment. We looking at blood hormones as well, so different hormones, and dietary assessment. Also, we have data analysis projects. We have laboratory-based projects that are interested in more biochemistry or molecular type stuff. Or you might want to do a literature review. So we have a whole range of different things pretty much for everyone. And this actually tends to set the scene for what you want to do later. And this is what we tend to recommend. I definitely strongly recommend this. You do a project that fits for your own interests and passions and what you might want to do later. So if for example, I think, for example, Eleni is interested in doing dietetics, then I remember we had a chat a while ago, is that, my advice is that we would do something clinical, do a clinical focused project. And so Eleni's doing a project with a dietitian, Dr. Papada, who actually runs a dietetics program. So in terms of our teaching expertise, this is another reason why I get so passionate about this. And I've worked at quite a few institutions actually over the past, it's quite a long time now. I forget how long I've been teaching. But the one real is a mega bonus, okay, that you guys probably won't be so aware of, but you might do along the way, is that we're really lucky because UCL actually, it really is genuinely a true world leader in research. And it's a very research intensive university. The other thing about our course, so first of all, that means that we have research, the true meaning of research-led teaching, which is the idea is you might have some, cutting edge scientists and researchers who actually come in and talk about like what is the current research or their own research, for example, and how that informs, future work and future study or clinical practice, for example, as things change in nutritional guidelines. And so, I always give this example. Myself and my colleague, Professor Simon Eaton, we run a growth and development module in the second year. We're super lucky to now have 5 professors, eminent professors, actually working on the course. So the sorts of people who have literally written textbooks on the recommendations for infant feeding, for example, childhood growth. We have a good example, Professor Tim Cole, who actually helped develop the childhood, these growth charts that you see, go to the doctors, you might have had this yourself when you were younger, you see the growth chart. Now, he actually helped develop those with the World Health Organization. So literally these people teach you on our course, which is amazing. And also because we're obviously very closely linked with UCL Hospital and all the other satellite hospitals and the Royal Free Hospital, that means that we have all the clinicians, all the doctors and dietitians talking about things like, for example, clinical nutrition. So we're very lucky to have them. In terms of how we assess you, and this is another important point, is that we try to develop transferable skills that you can use in the future, okay, to get you thinking about things. And what are examples is because it's not just about doing well in exams so you get a good grade. We try to teach you important transferable skills. Lots of, for example, presentation skills, presenting in different ways, presenting posters, doing PowerPoint presentations, both as a group, an individual. You do video projects, you're presenting your dissertation, for example. So these are like really super useful skills. So when you come out of this, if you go to a job interview or you go to an interview for a PhD position, you can feel confident. You can say, okay, I can do this. I can do a presentation. I can stand up and talk about, my dissertation project for 15 minutes and do a really nice job. And so this is what we try to do. And we also try to test you in different ways and develop different skills like writing, for example, literature reviews. You've got to write your dissertation, do practical reports, for example, so exposing you to research. And also some other novel stuff, like, as I mentioned, things like video projects, as well as your traditional exams as well. Could I quickly ask, Eleni, just a quick question, right? Would you say that, I mean, obviously you're going to have loads more this year as well, but would you say it's been helpful doing presentation assessments?
Oh, yes, definitely. I think because presentation assessment covers a broad range of skills,
Yeah.
which is like both research, but like also like communicating your results. Just a reminder, we only have 2 minutes left
2 minutes,
for
amazing.
questions.
Classic. This is me, as I usually do. Thank you so much. So anyway, so we do our best to set you up for your future, essentially. And on that note as well, our course is fully accredited with the Association for Nutrition. Again, this is actually super critical because if you want to apply for jobs or go for any positions afterwards, they're always asking now that you're an AFN associated registered nutritionist or a full registered nutritionist. And our course is fully accredited, and you can look it up on the AFN website. So that's also very important. In terms of careers, we have people coming from all different things, going to all different things, such as in particular things like dietetics and clinical nutrition and public health nutrition. And then just to finish off, we actually have, so if you're thinking in the future, doing this degree might lead to other things. In particular, we have four really fantastic programs. And as I said, we've literally got 120 other students this year. And we actually do have dietetics as well as some new novel courses like obesity clinical nutrition. And we have experts in the eating disorders world who cover an eating disorder clinical nutrition course too. And I think probably two outward questions. Are we completely done for time now?
Yes, we're
Yes.
completely out, but there is one question.
Yeah.
Xander asked, how popular do you think that this area of medicine will be in, say, 5 to 10 years in the future?
Well, I mean, it's very important now in lots of different ways. So when we talk about what you mean just in nutrition or dietetics, I mean, the main thing to recognize is that lots of disease conditions we have in our current world are because of the nutritional issues. So if we can try to improve recommendations and guidelines and behavior change to try and change people's behavior to eat differently in a certain way, that's obviously going to be super critical to reduce disease burden. And then the other aspect of this is how do we manage disease burden? So again, there's a lot of folks that are trying to improve the whole, clinical nutrition dietetics world as well. And so, but if you have any questions, please feel free to email us, I should say. And thank you very much.
The rest of the questions are not based on the content of the degree, but more of like, does UCL offer degree apprenticeships?
So,
This type of questions.
are we allowed to overrun? Or so I'll make it 5:31 now. What if we're allowed to overrun? So now, if you mean like things like internships and things, So typically that gets a little bit more complicated. It depends specifically on what you want to do. We do have some internship schemes where there's a little bit of money available sometimes for some students to do little bits of work in the summer. For example, work in a laboratory to get some research experience, for example. That's perfectly possible. In terms of mentoring, usually it's the other way around. I might, for example, ask some of our MSc students to help mentor BSc students. So the term mentoring is different, but internship experience, that is possible, depending on different factors, for sure. I'm not sure if that covered your question or not, but
I think you also forwarded us a studentship at one point
yeah.
with a PhD.
Also for students, yeah, definitely. So, and things like, funded PhD studentships after this, that again, to be completely honest, funding is quite difficult to come by, but UCL is a massive place with lots of really great researchers. And so you find that, several times a year, there'll be projects that come up where we will direct our students, say, if you're interested in certain projects, they're fully funded. Then you could do a PhD, for example. If some of you are more research focused and that's what you want to do, that's definitely a possibility too. Yeah.
Thank you for answering. Another question is, how does any data about the distribution of companies or hospitals where graduates eventually work in?
Say it one more time. Have we got any data?
Do you have any data about where the students that graduate from this course end up working?
Yeah, so we have a little bit of data, but we don't have the complete picture, unfortunately. We'd like to have the complete picture. But tend to be, what we find is that, for example, we have lots of people going on to different companies, some working in public health. I had some students go on to do things like PhD research, lots of students in MScs, some of them going into teaching, couple going to sports and exercise, lots of people, as I say, going to do dietetics. To be honest, that's why I'll put that in red. That seems to be the big one that people are interested in. And then one or two is much less working with clients, because really you have to build up a portfolio to become a full registered nutritionist to be able to do that properly, to be honest. It's usually our MSc students who tend to go down that type of route, become for private nutritionists. So you could do that, but really you'd probably want to do an MSc first of all. And we do have a few people working in the NHS as well. And then we have other students that some students go off to study medicine, working in business. I've had one or two students going to LSE, London School of Economics. So there's lots of things you can do. And I think that's the other thing about our program, is it is very flexible in that we do cover lots of different things because of the medical sciences component as well. So if you do well and are well across all the modules, it means you could do lots of different things actually. There's a high flexibility and transferability of skills.
Okay, so I think we're out of time, unfortunately. But this has been a great session. We will need to leave it here. However, if you could please provide us with your feedback and about today's session by filling out our survey, which will appear in your browser at the end of today's event, it would be greatly appreciated. Thank you all for your comments and questions, and thank you to Dr. Adrian Slee for an excellent session. Have a great evening, everyone.
Thanks so much, Lenny. Thanks so much,
Thank you so
everyone.
much. It's been great.
Bye-bye. Bye.